The mission of the AFCC is to provide the finest care and support to unborn babies with a fetal anomaly and their moms. Our care is family-centered and complete. For some families, this means access to information, confirming a diagnosis, speaking to a pediatric specialist about their unborn baby's condition. In other circumstances, access to cutting-edge therapies done either when the baby is still in utero or during delivery may be offered. The care continues after birth. The pediatric specialist that the family saw in the AFCC may follow that child into childhood and beyond. Finally, the AFCC is committed, through research and further development of surgical innovative techniques, to widen the medical and surgical treatments offered to future unborn babies and their moms.
The Advanced Fetal Care Center team is made up by multiple multidisciplinary specialists. Beginning at the front desk, we have the administrative staff. That might be the first person that takes the referral call. And then there's a team of nurses, there's a genetic counselor, a social worker, and then we bring in whatever pediatric specialist that we think is appropriate for the anomaly that's being described. Oftentimes, once the family gets here, there may be another concern, and because we're here at Children's Hospital with so many experts at our beck and call, we're able to bring in someone that we didn't think that we needed last minute to try to do one-stop shopping for this family to be able to get as much information that they can at a very critical period of time.
We see a wide variety of patients. One of the most common diagnoses is hydronephrosis or a kidney problem, but we see fetuses with brain anomalies, heart anomalies, tumors or masses in their chest or abdomen, orthopedic problems. Clubbed feet is pretty common, cleft lip and palate. So there's a variety of congenital anomalies that we see.
When expected moms and families are given the news that something's wrong, this news is not only devastating for that moment, but it will mark time for years to come. Families need information in order to make difficult medical decisions.
So when we started the AFCC program in 2000, it was a focus of a fetal surgery program because Dr. Jennings, who's the director of the program, did his training at UC San Francisco with Dr. Harrison, and he brought fetal surgery to Children's Hospital. And early on, those are the patients that we saw, patients that were undergoing fetal surgery. I think what we learned early on is that not only women that have babies with surgical problems needed the prenatal counseling and the prenatal education and the preparation, but women that had babies with all types of congenital anomalies. So it went from a fetal surgery center to a center that had a comprehensive type of care for women who were pregnant with babies with different anomalies. So we saw women with babies with all types of different abnormalities and specialties.
A typical evaluation day is a very long and often grueling day for families, and we work really hard to make them feel comfortable and safe in our environment. They come in very scared. They've had some information given to them that obviously has raised a lot of concern regarding their fetus, their baby, and when they come, they are welcomed into our center. We're fortunate to have some space here within Children's Hospital that's very comforting. We are able to do ultrasound and fetal echo right in our area, and then fetal MRI is right around the corner. So depending on what their needs are, they can have their imaging all right here in one location, if that's appropriate.
There is not, most of our patients don't have fetal surgery, but there are a few patients who do, and the largest number of fetal interventions that we do are for fetal cardiac interventions, somewhere between 20 and 25 weeks usually. And usually the most common procedure we do is to dilate the aortic valve with a balloon. And the mother's asleep, the fetus is also given anesthesia. And if that is successful in a small group of those patients, they will not develop hypoplastic left heart syndrome and still have a 4-chambered heart after birth. There are a few other reasons that we might deliver a baby here at Children's, and we call that an exit procedure. It is a procedure done at term at 38 or 39 weeks. So instead of letting the baby deliver naturally, we deliver the baby partially and leave the baby on the mother's placental circulation to get oxygen, and then have the right team of specialists in the room, including the high-risk obstetricians, to do the C-section part of the procedure, and then the pediatric specialist who would either place a breathing tube or put the baby on ECMO, which is bypass for the lungs that may be severely underdeveloped in a condition such as congenital diaphragmatic hernia, or a baby that has an airway obstruction would need intubation by specialists here at Children's. And then once the baby is stabilized, then the cord can be cut and the baby will be fully delivered and go to our ICU, and the mother would go back to the OB hospital.
The role of the nurse practitioner in the Advanced Fetal Care Center is to provide counseling and education in collaboration with the consulting physicians to families. Our role begins with the first phone call when the referral comes in. Usually one of us will call the family back as soon as possible to start the educational process, to discover what they've heard. Often at that point they're quite anxious, so we begin our counseling right then and there on the phone.
As nurses and counselors, we also take notes for families during the visit so that we sit with them during their consult so we can be a second set of ears for them. As they're very stressed while they hear this news, it's good for them to have someone else taking the notes and recording for them what they're hearing from the consultant. When they go home, they often refer to those notes, call us back and say, can you explain that again to me? And so we do a lot of reinforcing of the information that they already get from the physician.
I think one of the important things that we started early on in the Advanced Fetal Care Center was our weekly conferences. It was something that was started early with our colleagues at UC San Francisco. Initially, it was a video conference where we viewed their conferences. We presented a few of our cases to them, and they gave some suggestions. This was new. It was early on in the program. And as we grew, and as our program grew, and our staff grew, and the volume of patients grew, and the complexity of patients grew, what we ended up doing was developing our own conference, which has now grown to probably 85 people a session. It's 1 day a week. It's an hour. And there are a variety of disciplines, from pediatric specialties to obstetricians to radiologists to genetics. It's probably one of the biggest conferences in the Harvard medical area.
I think one of the benefits of coming to the Advanced Fetal Care Center is the benefit of one-stop shopping. Families can come and in one very busy day get a lot of information from pediatric specialists. Because of the nature of medicine these days, there's so much information that it's hard for everybody to keep up with the latest information. And by coming to Children's Hospital and meeting with the pediatric specialist in the area of concern, they can get very accurate information in a very concise and convenient manner. And I think for families that are in such a stressful situation, it's an invaluable service.